Hello, everybody. Welcome to my YouTube channel, Homeopathy Super Sessions by Dr. Jagose. Today, I'll be doing chapter number 23, the second part of Psora. Well, in the GIT complaints, there is extreme hunger, or the patient is extremely hungry. Hunger, even when the stomach is full, they are never satisfied even while eating. So there is excessive hunger. They basically overeat. They're craving for sweets, acid, sour things, and hot food. And in fever, they crave indigestible things. However, in pregnancy, they long for peculiar things, yet after gestation, they loathe the things that they have craved. So this is important. This you have to mug up the cravings and aversions of all the miasm. So craving for sweets, acid, sour things, and hot food. Basically, all the cravings will come under Psora with the exception for a few. And in fever, they crave for indigestible things. In pregnancy, they crave for peculiar things. But after the gestational period is over, whatever they crave for during pregnancy, they have a loathing for that. Crave for fried and highly seasoned food, meat and greasy foods, but they do not suit them. So they also like the meat and greasy foods, but it doesn't suit the GI tract. In tuberculosis or miasm, there's an aversion to meat. In Psora, also we get aversion to boiled food. In fever, they have aversion to sweets and crave for acids. Psora craves for hot food. Syphilitic prefers cold food. Psychotic wants the food either hot or cold. There is a weak, gone feeling in the stomach in the middle of the forenoon. Hunger at night also is a prominent symptom. So all gone sensation in the stomach, or a weak stomach, or a weak gone feeling in the epigastric region, which is worst in the forenoon, that is 12 noon, and also at night. There is weakness, gone feeling in the stomach in the middle of the forenoon, hunger at night, which is also a prominent symptom. Of course, this is repeated twice by mistake. There's a lack of power of assimilation with characteristic gnawing in the stomach with sensation of heat and cold. So, no doubt there is an increased hunger, ravenous appetite with the characteristics, aversions, and cravings. And however, there's a lack of assimilation also. Sensation of fullness, gas, bloating, etc. are all marked psoric traits. Cannot endure the slightest touch on abdomen, fears even the slightest contact, probably because of the abdominal bloating. They are accompanied by heartburn and water brash. Most of the aggravation of Psora occur after eating because they overeat. Craving for hot food, syphilitic prefers cold food, psychotic wants their food either hot or cold. Abdomen feels full after eating. There is much distension, worse in the morning. The muscles are flabby and all the abdominal pains are better by heat. Diarrhea induced by overeating, colic and watery diarrhea, usually in the morning, spasmodic, offensive, and painless diarrhea, which usually ameliorates the sufferings. Aggravated by cold, better by hot drinks or heat in general. So out here, the diarrhea is there from overeating, colicky and watery diarrhea. Here, the colicky pain is not so much marked in Psora, but it is marked in the psychotic miasm. In psychotic miasm, you get constrictions, you get vasoconstriction, you get colicky intermittent type of pain. So in Psora also, maybe the colicky pain is very, very less. And you get a gushing watery diarrhea, which is usually in the morning. Soon as the patient gets up, he has to rush to the bathroom or else he will soil his clothes. So there's an urgency to pass the stools. So spasmodic, offensive, and painless diarrhea, which usually ameliorates the suffering. So the diarrhea is there, which ameliorates the suffering. Constipation is stubborn, marked, and persistent. Small, hard, difficult stools, no desire for stools, or there may be alteration of constipation and diarrhea. So even alternating states or alternating, or you can say, or changeable states. These are again present in the psoric miasm also. The chest complaints, anemic condition. The cough of Psora is dry, teasing, spasmodic, and annoying. Expectoration is usually mucus, scanty, tasteless, or has a sweetish taste. Heart complaints, they are again functional disturbance with violent rushes of blood to the chest. Sensation of weakness, goneness, or fullness about the heart. Anxiety always is present, and fear are accompanied with heart symptoms. Fear that he will die from heart trouble. So you out here, you will get sudden palpitations, awareness of one's heartbeat, of a weak sensation, all gone sensation about the heart, and all the heart complaints are just functional disturbances aggravated by emotional disturbances also. And along with this, there is a great fear and anxiety along with the heart complaints. Fear that he will also die. So the fear is marked in Psora because of the anxious nature. He does not have many uncomfortable sensations such as the sharp cutting neuralgic pains about the heart. So there's no uncomfortable sensation about the heart, but there is just awareness of one's own heartbeat, that is palpitations. Patients think they are about to die and want to lie down and keep quiet. As I told you, all the symptoms are better by rest. In psychotic and syphilitic heart patients who die and then suddenly without any warning. So in Psora, the heart complaints are there, only functional disturbances, palpitations, maybe an uncomfortable sensation around the heart, but nothing of a major character, like a sharp cutting pain or a dull aching pain or a heaviness in the chest, etc. So, and all these complaints are associated with fear and anxiety. Patient thinks that he will die. Whereas in the psychotic and the syphilitic patients, the heart complaints are there, they are pathological nature, and suddenly they get heart complaints or they get chest pain and they die without warning. So in the psoric patients, there is a warning, there is an uncomfortable feeling, there is palpitation, there is anxiety, there is anxiousness, but it is only functional disturbances aggravated by emotional stress and strain. And the patient will think that the patient will die, but it is not so, except in psychotic and syphilitic, where they die without any warning. The psoric heart conditions are very much influenced by strong emotions like joy, grief, fear, and so on. So I told you, all emotional stress will aggravate the psoric heart conditions, like excessive joy, grief, fear, stress and strain of modern life, etc. Also is aggravated by eating and drinking. There are palpitations and eructations of large amount of gas, always conscious of his heart condition and is always constantly taking his own pulse. So he feels that his heart will stop beating. So every time the patient will check this pulse, whether it is functioning properly or not. In the genitourinary tract, retention of urine whenever the body gets chilled, and this condition also will arise in old people. Involuntary urination when sneezing, coughing, or laughing. There is smarting and burning pain on urination, but not from pathological cause. So you may get a burning micturition, but if you examine the urine complaints, there is no pathology in the urine. That means there are no bacteria, there's no proteinuria, there are no pus cells, except that the sensation of burning and smarting is there. So again, you are getting functional disturbances. Many symptoms of the stigma are reflected in the sexual sphere, especially in the women. The functional disturbances are closely related to the emotions. So as I told you, the emotional disturbances in Psora are very important. Mostly in all the parts of the body, emotional disturbances will give the symptoms of Psora or will aggravate the symptoms of Psora. So we get dysmenorrhea, amenorrhea, and many other conditions result from such functional disturbances. Skin. Now, in Psora, the skin symptoms are important. Itching is a persistent symptom or the hallmark symptom of Psora. The skin is dry, rough, dirty, or unhealthy appearing. As I told you in the first part of the video, face also has an unhealthy appearance, unwashed appearance, doesn't like bathing. Irritability and roughness of skin are worse when the patient doesn't take a bath. There is very little suppuration. There may be a few vesicles or a papular manifestation. So in the skin complaints, there is only the first stage of inflammation, furuncles or boils, or the first stage of inflammation of acne only. There will be no pus formation. Psoric eruptions are not noticeable by the color, but by the roughness of the skin. And also along with the eruptions, if you touch the skin, it will be quite rough, dry, and coarse to touch. Eruptions have the same color as that of the skin unless there is marked inflammation. So if there's a first stage of inflammation, you'll get redness of the color. If not, then the eruptions have the same color as that of the skin. With dry skin, there's a tendency of fine, thin scales. The eruptions dry down and scale off. So whatever skin complaints are there, it is associated with dryness along with scaly eruptions, or when they itch, the scales fall down. Erysipetalous manifestations are a combination of psora and syphilitis and psychotic miasm. If there is any syphilitic taint in combination with the psoric base, the patients are apt to be susceptible to impetigo. So that's all in this chapter. Hope you'll like it. Thank you for your patient hearing.